We don't do a lot of our questions over the phone. We don't tie the referral sources up, social workers, doctor's office up. We get a name, we get a diagnosis. What are we seeing this patient for, and when do they need to be seen? Everything else is either faxed to us or sent to us by email or web. We have an ESIN referral program that's connected with a lot of the larger hospitals, and it's a web-based. So the social workers can just attach the documents they need, send those to us, and we pull them off of the web. We get a text and email message when it's arriving, and we can email back to them and say we accept that referral. So it's very easy for them, and it's not so time-consuming. Otherwise, they would have to get on the phone, they'd have to give us all the demographics and addresses, and it's just real time-consuming. So it's quick and easy. We have an individual that takes those intakes here in our office. We don't have a central intake so that, you know, we're not sending all of our referrals to St. Louis or Springfield or somewhere that's not familiar with our area, our territory, and our staff. So they get to talk to the individuals that are caring for their patients. I think if you look at our history, if you ask questions, if you talk to your physician referral, you're going to see a lot of positive responses. You're going to see that we have quality care, we have quality physical therapists, back to the customer service, that we go out of our way to make sure that those patients and consumers and referral sources have what they need. I think our technology is a plus. We can provide what is needed for that patient. Our service area is a plus. We cover a large area, which means, and a lot of our staff live in those areas, so they're your neighbors and your next door neighbors and your people down the road. So you're seeing people that are familiar with your area. If they don't have a lot of family and they're elderly, they really look forward to that nursing or therapy visit twice a week or 3 times a week. And sometimes it's hard to get out of the house because they really want to visit and know what's going on. So there's a lot of bonding with the patient, and that I think is probably the most enjoyable. You get to, unlike the hurried hospital settings and acute care, you get to know the patient at their home level.